If you've followed my channel for a little while now, you know that I talk about the interconnections of different movements and how the whole body is connected in various ways. And in this video, I want to share with you some thoughts or insights on how the middle back here, your thoracic spine, impacts your shoulder and your scapular position. So a quick test I want you to do. Up tall, I want you to do external rotation here, then go to about 45 degrees external rotation, and then 90 degrees external rotation. With that test, you're going to notice that at 0 degrees here, you have less external rotation than at 45 and then at 90. And that's because the shoulder opens up in different positions, and it opens up differently based on the angle of the scapula and the angle of the glenohumeral joint. Now let's perform that same test from a slouched position. So here, go out again, then go up and out, and then lastly, go back that way. The thing that you'll feel, and this is something that you need to internalize and think about, is when you're slouched down and you go into external rotation, it significantly limits the position of the glenohumeral joint and your ability to get your arm back into position. The reason that is as the thoracic spine drops forward into flexion, it pulls the upper trap, it pulls the pec, and it tips the scapula anteriorly. That anterior tip of the scapula, because the scapula is where the glenoid comes from, pulls the joint forward and then pulls the humerus forward. So as you go back into external rotation, you're butting up against the backside of the joint. So if I'm here and then I go back, the shoulder is going forward and it limits total shoulder external rotation, almost creating a cramping sensation or a locked sensation in the back of the glenohumeral joint. If we change that around, so from here upright, then I have a lot more external rotation. This movement, if we think about this from a rotator cuff standpoint, from a subacromial impingement standpoint, it's extremely important that if you're doing rehab for a shoulder, you've got to be focusing on the position of the thoracic spine because of how those are directly connected. If someone is really stiff in their T-spine or their CT junction, they're not going to be able to achieve full shoulder rotation. So that might be the underlying driver of why they're having shoulder pain to begin with. This is really, if we're talking about pitching mechanics and the ability to extend and rotate, that's going to give you way more leverage back through the movement to be able to perform a pitching type of motion. So a simple test you can do in the clinic, and you can do it from a pain provocation standpoint too, is one, check their rotation at 0, 45, and 90, and then have them slouch, same situation, and you'll see how limited the motion is and how it changes how the rotator cuff functions and how those things feel in the human body.